So good afternoon, everybody. My name is Dr. Alma Nenshi, and I am here again this week to present another wellness topic, and this topic is pain management. So there are a lot of people on our workshop here today on our webinar, and we'd like to be able to share some strategies that we have to help with pain, both the ones that we provide in the clinic as well as ones that you can practice at home. So I'm very excited about this workshop, and we're looking at it probably lasting about 45 minutes to an hour. And certainly if you have any questions or anything, please go ahead and type them in the chat or in the Q&A, and we'll be happy to address these after the workshop. So does anyone here have any particular pain problems that they were hoping to learn about in this class? If you have any, if you could please type them into the chat, then we can make sure that these topics will be covered as we're going through the workshop. Okay. I'm just going to move my little information here. Okay, so let's talk about pain in general, understanding what pain is. Pain is defined as suffering or discomfort, and it's usually caused by an illness or an injury. Everyone experiences pain differently, which makes it difficult to treat and difficult to diagnose as well. Pain is the body's way of telling us that there's something wrong, and it is also used to protect ourselves from harmful situations. For example, if you touch a hot stove, the pain that you feel will tell you to stop touching it and pull away. The brain reacts very quickly to these types of signals, especially for danger. So pain has been used in evolution to alert us to dangerous situations and dangerous stimuli that we need to stay away from. Chronic pain can be quite debilitating and can reduce our quality of life. Some of the common terms used to describe pain could be aching or burning, dull, stabbing, shooting pain. There can be tingling or sharp throbbing. And the most common causes of pain tend to be musculoskeletal in nature, muscle pain, tension, stress, overuse, injuries, minor injuries, things like that. So there are two main categories of pain, and the first is the pain that's caused from tissue damage or visceral pain, and the second is due to nerve damage or neuropathic pain. And the visceral pain occurs when you have organs or muscles or tissues that are inflamed, and the inflammation and damage to the actual tissues from an injury or perhaps from overuse. And some examples of visceral pain can include referral from your abdominal region, such as with appendicitis or gallstones, chronic chest pain, diverticulitis, and pelvic pain. Neuropathic pain, which is the second type of pain due to nerve damage. Neuropathic pain is caused by different things that cause nerve damage. So we're looking at diabetes, herniated discs, arthritis, spinal cord compression, multiple sclerosis, any number of these things that actually affect the nerve fibers. So the interesting thing is our brain has different ways to register pain. And primarily there are receptors that are in the skin and in the tissues that basically send messages from that area through nerve fibers, through the spinal cord, through the brain stem, and eventually up to the parietal lobes in our brain. And this is the area that we receive information about our body and our environment. So when the brain receives a message regarding where the pain is being felt, it also compares this with your history of experiencing that same type of stimulus. So for example, if you have a light feather that touches your skin and in the past that's never caused you any pain, that sensory input is going to be registered as something that's not painful. But there are people who have a challenge with how their stress systems in their body are working. And that type of sensory input for some individuals is excruciatingly painful. So how we perceive pain has a lot to do with the stimulus that you have and your emotional history behind what is going on with that stimulus, and as well the integrity of the pathways that that signal is traveling, which is the spinal cord and the brain stem and then the other nerves that are involved. So when a person experiences pain, the brain releases these chemicals that are called endorphins, which are morphine-like substances. And the pain research out there has discovered that brain activity changes in response to acute and chronic pain. So sometimes acute pain therapies are not effective for treating chronic pain. So these endorphins that are circulating in our body, these morphine-like substances, help to alleviate some of that pain that we're experiencing, but primarily help more with acute pain than chronic pain. Acute pain is relatively more sharp and severe. It typically lasts anywhere up to 3 to 6 months, and it's usually related to tissue damage. Chronic pain usually lasts a lot longer, more than 6 months. The nerve signals continue firing those pain responses, or the stimuli that your brain registers at pain, even after you think that you've healed that tissue. So those chronic signals can still be firing even after the stimulus that's causing that pain is no longer there, which is what makes managing chronic pain quite interesting. And it's wonderful to help people with chronic pain, because usually these are very complex puzzles that we need to help sort, and it's really rewarding as a practitioner to be able to help people with chronic pain. So there are often times where chronic pain occurs without an obvious cause. So sometimes chronic pain is a consequence of an injury or a health condition. So you can think of maybe past injuries or surgeries, back problems, migraines and other types of headaches, arthritis, nerve damage, infection, fibromyalgia. These are all well-known causes of chronic pain. And these symptoms can range from a mild to severe sense of, you can have dull aches, you can get throbbing, burning, shooting pain, squeezing sensations, stinging sensations, soreness, stiffness. These are all symptoms that relate to chronic pain. So when we're looking at helping an individual who has chronic pain, the main goal is, of course, to help reduce the pain that they're experiencing, because chronic pain can be quite debilitating and often can cause an interruption with just normal daily activities. So there are natural solutions available for those individuals who are not comfortable taking too much medications and want to leave surgery as absolutely last resort. So the natural solutions that we work with in our clinic include chiropractic care, accelerated recovery performance, which is ARP-wave technology, and frequency-specific microcurrent therapy. We also have Erchonia Cold Laser therapy and Neurosage therapy. So I'd like to talk about each of these individually. Chiropractic care employs a very specialized technique of pain management. It uses a whole body approach and a whole person approach. In our office, we always integrate central nervous system diagnoses with what we're doing with chiropractic care. So anything that's off balance with functional asymmetries with the brain or with the nerves that are exiting out of the brain stem that innervate your head, and then also the spinal cord functions, and then our peripheral nerve functions. So we try and examine all of these areas when we're trying to help our patients. So if you're looking for a safe and natural and effective treatment to try and help with pain management, this is probably going to get you very good results. Chiropractic care is going to help to relieve the pain. It's going to help improve functions and mobility. It's going to help patients better manage their condition at home as well. So a chiropractic treatment, usually what we start with is an initial exam, and then we discuss what your health concerns are and what your health goals are to identify where the particular challenges are and the best way to help treat these so that you can get back to a healthy functioning life. The treatment is called a chiropractic adjustment, and this is a very controlled, directed force into a spinal joint, and the goal is to help reduce stress and improve spinal alignment so that you're able to promote full function of the spinal cord and all of the peripheral nerves. So the research shows that chiropractors are clinically very effective and safe and cost effective. And some of the things that we can do in addition to chiropractic care to support the chiropractic care are pretty phenomenal, especially when we look at electrical therapies and laser and other types of neuromuscular stimulation, which we're going to just talk about right now. I did want to mention that the way chiropractic adjustments work is that we are firing joint receptors in the body, and the highest concentration of these are in the spine, but chiropractic treatments don't necessarily just have to be in the spine. We can adjust any joints in the body, and basically this has two effects. First of all, the signals from the muscles and joints travel up very fast compared to pain signals. So the speed at which we are able to send a signal from our SI joint or from our hip or our calf, these areas, the joint mechanoreceptor input is able to be sent very quickly up to the brain compared to the pain signals. And that will help increase the amount of neurotransmitters such as the serotonin and norepinephrine and other endorphins that are released in the spinal cord. And when these endorphins are released into the spinal cord, they descend and they actually block the pain signals from entering into the spinal cord and registering up to be perceived as pain. So this is in essence what happens with a chiropractic adjustment when you're looking at the clinical, the neuroscience behind it. So you are basically trying to use the speed of these mechanoreceptors that are firing to the brain in order to block the perception of pain signals in our body, and also to release endorphins into the cord to block the pain signals from entering into the spinal cord so that they aren't being relayed either. So that's how you can use chiropractic to help manage pain. So let's talk about some of the different types of supportive care that can help the chiropractic adjustments. So electrical muscle stimulation, this is something that can help to reduce inflammation and decrease muscle spasms and relieve pain. Now, many people look at these electrodes and they think TENS machines, or they think other types of electrical treatments that you can actually feel on your skin. And the type of therapy that we have in our office can use electrodes or can use wet towels to try and relay a very low intensity electric therapy called frequency specific microcurrent. And this is a technology that started back in the 1920s that uses this concept of resonance. So if you can all just close your eyes and imagine this big opera singer who's trying to resonate her voice at the same resonance as as glass. And so when the vibrational frequencies match up, the vibration from the voice interacts with the molecules and the energy that's holding the glass molecules together, and eventually there's a big explosion, or the glass shatters or breaks, because when those interactions occur, they disrupt any stability there is in that target area, meaning the glass. Similarly, we have energy that's holding different types of tissues together in our body. Scar tissue has a certain resonance to it. So if you're able to match the microcurrent frequency to that within the scar tissue can dissolve. And there are so many different applications for how frequency-specific microcurrent works, but the main thing is we want to try and help reduce inflammation in the body. That's going to help us to dissolve scar tissue and adhesions, to help to repair tissues like tendons, to improve circulation, to relax structures. And in essence, it does what in our clinic, we don't have massage therapists or physiotherapists, because the frequency-specific microcurrent is so specific to target specific tissues that we don't need these therapies in our office. It alleviates the inflammation from the spinal cord and along the nerve pathways, and of course reduces the scarring of the soft tissues that are involved from repetitive strains and other traumas. So it's a great adjunct to the chiropractic services in order to try and do all of the anti-inflammatory type therapies out there. The second electric therapy that we use in our clinic, and this is actually quite unique to my clinic, is called Accelerated Recovery Performance, or ARP-wave. And ARP-wave is a very interesting technology. There's, I think when I last checked, there were probably 2 clinics in all of Canada, mine being one of them, that was offering this technology. You find this technology in the locker rooms of many sports professional teams, such as the NFL and the NHL and all of that. And they use these technologies to treat injured athletes and getting them back onto the field and playing again very quickly. I incorporated this technology because I know that it is a great way of helping to increase the mechanoreceptor input to the brain that we talked about before. ARP-wave is used for muscle recovery. That can be from overextensive training or overexertion. It builds strengths in muscles very quickly. It's useful for restoring normal motion, and it's really a great technology that can help with trying to maximize your potential in terms of athletic performance, or even if it's just you've had a nagging pain for 7 years and nothing has helped with, this will probably help with that. So we've found a lot of people with chronic pain really respond well with the ARP-wave technology in our clinic. And it's pretty remarkable when you see you know, the muscle girth come back from an atrophied tissue, or when you are able to see an individual who hasn't been able to move their arm suddenly be able to get full range of motion with their arm with a few sessions. So it's pretty amazing. And I hope that if any of you have chronic problems that haven't been helped with other therapies, that you consider giving our office a call so that we can talk about this particular solution for you if that's what's appropriate. I also wanted to talk about the Erchonia Cold Laser. Erchonia Medical is a company in the States. I have purchased their equipment probably for 20 years now. And I purchased their equipment because they are researched, or they do a lot of research. They put a lot of money into publishing what their instruments can do in various different medical journals. And I want to make sure that the therapies that we have in our clinic are going to help you. And so I don't want to purchase a cheaper copycat instrument, cold laser, that says cold laser therapy does all these wonderful things when their lasers haven't been tested and published. So, you know, we want to make sure that every patient that comes into our clinic has the best experience and the highest potential for recovery. So we need to invest in products that are researched well. And I think Erchonia Cold Laser holds I want to say 11 of 13 patents in cold laser technology. Correct me if I'm wrong, I'm sorry, but it's significant. And so that's why we use it. Photonic energy enters into the body. You can laser right over your clothes. You don't have to be bare to the skin. And the laser light goes into the cells and actually increases the production of energy in the cells by about 500%. And when that happens, each cell is now re-energized to start functioning in a healthier manner. And in this way, it helps to reduce inflammation and helps to increase healing of tissues that may not be healing very quickly. So the cold laser therapy, it helps to reduce inflammation, it can help with scarring, and it also helps to regenerate tissues quickly in order to heal that particular structure. Now, we can use these therapies in combination with other things. So for example, I can use cold laser therapy, and in this image here, you see that the laser is shone on the base of the neck. And let's say it's at the level where the nerves exit to go to the hand. Then if I do nerve flossing exercises with the hand to alleviate pressure in the nerves that are innervating into the area, for example, with carpal tunnel, and I'm lasering at the same time, I'm getting a compound result rather than only lasering or only doing the chiropractic adjustments or only doing the nerve flossing exercises. So when you combine these therapies, they are so effective in trying to help with a lot of these chronic problems that people haven't seen results with. Another therapy that we have in our clinic is called Neurosage technology. Now, this is a relatively new technology. And the interesting thing about Neurosage is that it uses sound frequencies to help stimulate different areas of the brain. And neurologically, we're seeing improvement in strength and improvement in stress, improvement in vestibular challenges that people may have. So there's so many different applications for how Neurosage therapy works. It's specific to try and target the central nervous system using sound frequencies. So there's so much we can talk about it, but I just wanted to mention it for people who have concussions, people who've had chronic stress, people who have anxiety. These are definitely therapies that can help you. I want to roll into talking a little bit about techniques that you can be responsible for as well. So self-management techniques, you become the active participant in managing your pain. So research shows that self-management programs tend to reduce a lot of barriers in pain management. So basically, it helps people increase their ability to cope with pain. And the best self-management programs are those that teach you various methods of thinking about and responding to pain in order to help trigger those same neuro endorphin releases that you would if you had a specific therapy. So it's based on the idea that if you imagine doing something, your brain and body don't know the difference between thinking something and actually living that way or experiencing something. So athletes who visualize meeting certain targets and goals have a higher potential of actually actualizing those targets than an athlete that is not using visualization exercises. Guided visualizations are workouts for your brain to form neural pathways that are firing to get those results. So if you're visualizing being out of pain, that itself is forming those neural networks in your brain that are starting to fire. And it gives you greater success for you to actually be out of pain when you can use those guided visualizations to help you. And one of the things that we have in our clinic, and I'm sorry I didn't put a slide up about this, but we have our light and sound therapy, our brain tap therapy. And the light and sound therapy with guided visualizations that help you with chronic pain and stress management, losing weight, and dealing with your diabetes, and, you know, any other topic you can think of under the sun. They have over 800 different programs that help people from brain exercises and lifestyle management to overcoming addictions and all of that. So everyone who's on the call here today, if you want to send me a quick email, actually what I'll do is I'll just take a quick look here. So I see everybody on here. I just don't know who has the iPad. That doesn't have a name with it. But what I'll do is I will include something in the follow-up email for any of you who would like to have a complimentary session of this in my office. I would be happy to get that for you. And we can also arrange for you to experience this in the comfort of your own home using your earbuds, but still getting the guided visualizations that you can listen to help you with starting this whole self-management strategy of reducing pain. So there are other aspects than pain that we have to deal with when people have chronic pain. People do face many daily challenges. And while pain is important, you need to be able to not only manage the symptoms, but you have to modify responsibilities sometimes around the house or in at work. And there's also having to deal with coping with the negative emotional consequences of having long-term pain. A lot of people who have chronic pain do suffer from depression and other emotional challenges and diagnoses. And you kind of get to the point where you feel like you don't have full control of your life anymore. And you have to rely on a lot of your family and friends to help you with even just basic tasks. And so that's another reason why these self-management tools are so important, so that you can regain some element of control in your life and learning how to keep out of pain and not allowing it to overwhelm you. So the self-management techniques that I'd like to talk about briefly, these are helpful in trying to manage chronic pain and feel like you are back in control. Effective pacing, food choices, physical activity, reducing your tension, improving your sleep, improving focus and concentration, positive thoughts, and of course, physical ergonomics. So I'd like to talk about each one of these individually. So effective pacing. Many chronic pain sufferers refer to good days and bad days. So sometimes the pain can be so debilitating, those are your bad days. And sometimes when you have good days, you might overwork yourself, so you're trying to catch up on the stuff that you missed in the bad days, and then that can be a little vicious cycle where you may have done a little too much, and then you need more recovery time following a good day. So pacing is the difference between doing too many activities and not enough. So rather than doing everything good, everything that you need to on a good day, just break up your activities so that you pace yourself. So even if it's a good day, you have a certain limit as to how many activities you're going to do on that day. And then you're going to create a little bit of that every day. And when you pace yourself, it can really help with the symptoms you're experiencing. So you can set up regular rest breaks, you can break up your tasks, you can change your tasks frequently so you're not doing the same repetitive movements, or you can even work slower. But all of these can be very helpful in trying to help you pace your tasks so you're not overwhelming your body. Food is the one thing that everyone can control, and that's very good news. What you eat and drink throughout the day is going to impact your overall health and wellness. So one of the challenges that happen when people are on a lot of medication is their GI tract can slow down and you might feel a little constipated. So making sure you get enough fiber and water on a daily basis can help manage this. And of course, limiting your intake of any type of soda or tea or coffee. So eating regularly will help keep your energy levels up. So well-balanced meals throughout the whole day. And that will also help with how well your medications are working if you are on any medications. So talk to your doctor, learn about the foods that should not be consumed with certain medications, because there are some contraindications when you have certain foods with certain medications. But other than that, just trying to increase your water, having greater antioxidants, and reducing the bad stuff. Okay? Physical activity can improve the body's strength and flexibility and your endurance. Chronic pain can cause people to need to rest more frequently, and when that happens over time, that can negatively impact how much muscle mass you have and can increase your disability. So trying to do low impact activities are ideal. Even 10-minute sessions a few times through the day can help improve your overall well-being and reduce your risk for long-term disability. So exercises that you can try, cycling, walking. Some of the pools have opened up, so if you want to consider swimming or yoga, tai chi. For most people, physical activities, doing them with a friend is going to be more enjoyable than doing it by yourself. So maybe you want to consider trying to find some meetup groups or some classes that are offered that can keep you engaged with other people. And of course, when you're exercising at home, make sure you have your favorite music on, or you have the TV on, or you have something that's going to be there in the background that's going to help you pass time. When your stress levels increase, tension increases as well, and then that can cause increased pain. So any technique that can help to ease your stress and tension is going to help you feel more relaxed. So people stress for many different reasons. They are frustrated, they are worried, they are fearful of something. So managing your stress can help you develop a more positive outlook. So meditation is a wonderful mindfulness technique that helps to slow things down, and your ability to focus on your breath as you inhale and you exhale, that can help alleviate the worrying about all the stuff that's happening around in our society and the fear of future and past events. So there are a number of benefits associated with regular meditation, and these include reduce anxiety, reduce stress, positive emotional health, an enhanced sense of self-awareness. It definitely improves your sleep, and it helps to control pain. So easing stress and tension are very good. Lack of sleep can lead to fatigue and irritability, of course, stress and tension. So all of these make it hard for you to cope with pain. Depression or sleeping too late, napping and resting in bed for a long time. These are all things that can contribute to sleep challenges. So I recommend that you use your bed only to sleep, right? Like, you want to avoid watching TV, or you want to avoid reading or other things that you're doing in your bed. Your bed should be when you are with your partner or when you're sleeping. So you want to make sure your bedroom is peaceful. You want to keep it tidy. You want to get rid of the clutter. And setting up a nighttime routine is also very helpful. So consider taking a warm bath before bed. Listen to some relaxing music. You can read a favorite book. You can do some stretching. Definitely avoid any large meals before bed, and avoid eating or drinking anything with sugar and caffeine. Many people report that their perception of pain changes according to what they're focused on. So, for example, if you're needing to go to get some lab work done, and you see that needle right by the table, and you visualize how painful that's going to be when it enters your arm, that when it does enter your arm, it's probably going to be, that pain sensation is going to be more amplified than if you hadn't been focusing on that needle. So changing your focus from pain to something that's unrelated to pain, like focusing on a hobby or a book, or watching your favorite TV show, something that's going to make you laugh, being engaged with friends and family, and having interesting conversations that help take the mind away from your pain. These all are going to help reduce possibly the perception of your pain. And brain research shows that there are specific areas of the brain which are active during pain, and these same parts of the brain show lower activity when our attention is directed to something else during that episode of pain. So you could be experiencing pain, but if you shift your focus and not focus on the pain and look and change your focus to direct it to something else, your ability or your perception of pain is lower than someone who can't redirect their attention. So redirecting focus during a painful episode can be really difficult, but if you practice it, it'll come more naturally. And I think you just have to be consciously aware of what's going on. Just enjoy the present, focus on things that are making you happy, and that becomes a practice habit. So it's easy to engage in refocusing on something when you continually practice focusing on it. Okay, so a lot of focuses in that little spiel. Positive thoughts, again, we were talking about that brain tap technology. I'd be happy to share that with you. Being productive and happy is sometimes not possible with pain. So pain can be influenced by your thoughts. So if you can just take control over what you're thinking of, you may be able to control your pain. So there's cognitive behavioral therapy as a way of managing pain, and this is ways of that people develop skills to change negative thoughts into positive thoughts. And again, that will help to change your awareness of pain and help you develop some coping skills. So I just wanted to say that there have been some clinical trials involving cognitive behavioral therapy. And basically, they've shown that it alters your physical response in the brain by reducing stress. So stress levels can affect norepinephrine and serotonin. And again, those are those hormones that are powerful in controlling pain at the level of the spinal cord. And so when you do cognitive behavioral therapy, it shows that this helps with your norepinephrine and serotonin levels. And finally, I wanted to talk a little bit about ergonomics. A lot of us are working in other areas than what we're used to. You might be working at your kitchen table instead of your ergonomic chair and desk at your office. So we need to look at how you can optimize your environment and your workstation so that you minimize the risk of injury when you're doing certain tasks or using certain tools. So you want to try and apply ergonomics in daily activities. It could be as simple as improving your posture when you're sitting and you're standing. Be mindful of arching the lower back when you're sitting or when you're standing. It's not so much pulling the shoulders back, it's arching at the lower back. And also, you know, when you're moving and lifting objects, make sure you use your knees. Don't bend over from your back. You want to use your knees, bend down with your knees, and then lift up. When you go back to work, if you still are at work, or perhaps you might be considering a return to work plan, there are ITs and HR departments that can help you with the ergonomics of your workstation. And there are also practitioners like myself who are also available to check your workstation, either at work or at home. We can do that with Zoom calls, and we can do it with an on-site visit. So if you're interested in that, just let us know. So just to recap here, no matter what type of pain you're experiencing, there are always natural solutions to help you with better pain management. Chiropractic can offer a number of treatment options that are specifically tailored to what you require. And other things can be the accelerated recovery performance technology, or the ARP-wave technology, our frequency-specific microcurrent that helps to reduce inflammation and break up scar tissue, our cold laser therapy that revitalizes tissues and again helps with inflammation and strength, and our Neurosage technology that uses sound frequencies to help with more central nervous system challenges. So we can work together to develop a self-management plan for you that involves different aspects of eating and breathing and exercise and all of that. And it's just a matter of sitting down and discussing with you what are the things you're interested in, what are the things do you have access to, and what are some of the things you enjoy in your life, and how can we incorporate more of these. Also, the techniques that we used for self-management, again, they include pacing yourself, choosing healthy foods, engaging in physical activity, reducing your stress and tension, improving your sleep, improving your focus and concentration, positive thoughts, and healthy ergonomics. So I have a number of references. As always, I will be posting these on the summary for the YouTube video. And you just need to click on the links that we post that will be able to help you learn more about this topic and any of the aspects that we were talking about. So thank you for, that's not me, so thank you picture, but thank you for taking the time to participate. If you have any questions or concerns or anything that you'd like to talk to me about, please don't hesitate. We have email you can reach us at, which is askus@calgarywellness.com, our website, calgarywellness.com, and we're here for you. So if you have any questions or concerns, don't hesitate to call us. And I'm going to stop this recording so I can address some of the live questions that we have on this webinar today. So thank you so much, and have a wonderful rest of the day.